Good afternoon. My name's Christina, and I'll be talking today about wound prevention and wound management. I will go ahead and jump right into some basic steps for diabetes management, as doing these steps can greatly reduce your risk of wounds and other diabetes-related complications. So our diabetes management basics include a good solid meal plan, which should involve reduction of intake of carbohydrates, selecting higher fiber carbohydrates, certainly an exercise or a movement plan. Some diabetes medications might be part of your plan, whether they be oral or insulins or other injectable diabetes medicines. Blood sugar monitoring is so very vital to diabetes management because we don't feel blood sugar. So if we're elevated, we might not know it. If we're monitoring, whether it be by finger stick, with a glucometer, or if we're wearing a CGM, it's a vital step to managing blood sugars. Of course, I put managing these items above, which sometimes is a challenge. So diabetes is an ongoing, treatable condition, but it takes several steps and a little know-how to take care of diabetes. So how does diabetes affect our skin and circulation? Ultimately, diabetes can cause a loss of feeling, which makes it hard to feel a problem when it occurs. For example, you might not feel a blister, a sore, a callus, or a cut. Also, diabetes over time can reduce the amount of blood flow to the lower legs and feet, setting you up to having some poor circulation in those areas, which can also negatively impact our skin health and increase our risk for a wound. So the leading risk factors for diabetes wounds have been identified, and the 4 leading risks or causes include neuropathy, vascular disease, foot deformity, and trauma. Neuropathy, deformity, and trauma have been present in 63% of diabetes foot ulcer cases. Neuropathy was the most important component causing foot ulcers, and poor circulation is second most in leading causes for ulcers. I want to say something very positive, which is 80% of foot ulcers are potentially treatable. So there is some good news, and that is if you develop this problem, there are steps you can take that can help you heal and prevent another alternative like an amputation. So 80% of ulcers are not only potentially preventable, but they're also very treatable. Neuropathy, in particular, diabetic neuropathy, is nerve damage caused by high blood sugar levels. Half of people with diabetes have some neuropathy, and up to 50% of this diabetic neuropathy is asymptomatic, so people may not realize that they have the condition. If they have symptoms, the symptoms might include tingling or pins and needles in the feet, foot pain, for example, burning, stabbing, or shooting pains. There might be an increased sensitivity to touch, heat, or colds, or there might be a sensation of numbness or weakness. If neuropathy is not recognized, and if preventative foot care is not implemented, people with diabetes are greatly at risk for injuries to their insensate feet. How do we diagnose neuropathy? 2 primary ways are to use either a tuning fork or a monofilament. One very effective method is that C128 tuning fork. Vibration sensation duration is measured on both feet twice in this particular assessment. Another approach is the monofilament test. In this test, a small fiber is pressed on between 1 to 10 sites of both feet with the client's eyes closed, and they verbally indicate when they feel that fiber or monofilament. Peripheral vascular disease occurs when blood vessels in the legs are narrowed or blocked by fatty deposits and blood flow to the feet and legs decreases. And foot deformities could include calluses or corns, mycotic nails, bony prominences. You can see in the bottom picture here on this slide, that's a shark coat Charcot joint, and basically the bones in the foot have collapsed. The person no longer has an arch, a bunion, or even a prior amputation. The use of very specialized therapeutic footwear is recommended for people with diabetes, especially if they have one or several of these foot deformities. So diabetes foot ulcers most often occur on the ball of the foot or the bottom of the big toe. Ulcers on the side of the foot may be due to poorly fitting shoes. Some ulcers do not hurt, so please check your feet daily for signs of a problem. Every ulcer should be seen by a healthcare provider right away. Neglecting ulcers can result in infections, which can in turn lead to the loss of a limb. Some data on diabetic foot ulcers. People with diabetes are 15 to 26 times more likely to have an amputation than people without. 9 to 20% of these foot ulcers do end in amputation. 28 to 83% after healing re-ulcerate within 12 months. So diabetic foot ulcers are one of the leading reasons for diabetes-related hospitalizations, leading to 20 to 25% of all diabetes-related hospitalizations. Again, I want to be very clear, more than 80% of these ulcers were preventable. So some foot health data. Diabetes-related complications may present initially in the feet. Foot symptoms increase the risk for comorbid complications or other non-traumatic lower extremity amputations. Good news, however, is that with routine foot care, up to 80% of diabetes patients have treatable foot issues. Research has found that daily foot care and skin care precautions can greatly reduce the risk of your diabetes-related foot wounds and ulcers, and it can improve the chances of healing those if they occur. The incidence of amputation has decreased more than 65% in the past 20 years. So what are these prevention practices? Our healthy feet do matter, and the first is to include a podiatrist on your medical team. A podiatrist is a physician who is specialized in foot care. Ask them if you qualify for special shoes. Ask your podiatrist to send your exam results to your other doctors after each visit. The second is check your feet every day. Set a time every day to look at your bare feet for calluses, cuts, sores, blisters, red spots, and swelling. Use a mirror to check the bottoms of your feet. Third is wash your feet every day. Use warm water, not hot water. Do not soak your feet, as this can dry them. Make sure after bathing and washing that you dry your feet well, especially dry between your toes. Keep your skin soft and smooth. Rub a thin coat of lotion over the tops and bottoms of your feet. Do not put lotion between your toes, as this can lead to a skin breakdown called athlete's foot or a fungal infection. Wetness between toes, as I mentioned, is a cause for infection. Check with a podiatrist about the best way to trim your toenails or care for corns and calluses. Over-the-counter products for corns and calluses may harm your skin. Do not use them. Do not walk barefoot. Wear shoes that fit well and protect your feet. Check inside your shoe before you put it on to make sure there's no debris in that shoe. Protect your feet from hot and cold. Wear shoes at the beach or on a hot pavement. Do not use hot water bottles or heating pads on your feet. They ultimately can burn your skin. And keep your blood in your feet flowing through activity. Put your feet up on a chair or a footrest when sitting. Wiggle your toes and move your ankles up and down for 5 minutes 2 to 3 times a day if you sit all day. Do not cross legs for long periods of time. So a very key message in diabetes control is to prevent diabetes complications. We really do need to manage the ABCs. That's the A1C, the blood pressure, the cholesterol, and we should try to prevent or stop smoking. The A1C is the 3-month blood sugar average, and the current recommendations are that you keep your A1C less than 7%. That's a general target that can be personalized to you by your healthcare provider. But generally, the American Diabetes Association recommends the A1C less than 7%. Keep your blood pressure as close to the normal target of 120/80 as possible, and manage your cholesterol, as cholesterol can lead to atherosclerosis or fat buildup that leads to poor circulation. Wound healing and management. What if you've already got a wound? Well, there's 4 stages of wound healing. They include bleeding, inflammation, proliferation, and remodeling. It can take from 3 weeks to as long as 2 years for a wound to finish the healing process, depending on the severity of the wound and the status of your diabetes control. Hyperglycemia or high blood sugar impairs and slows wound healing. Focus on lowering your home blood sugar readings through meal planning, medication consistency, and monitoring. Gradually reduce your A1C if it has been elevated. Hyperglycemia or high blood sugar causes tissue damage through a non-enzymatic glycation of proteins. These proteins, like collagen, fibrin, albumin, and hemoglobin, accumulate advanced glycation in products, which can cause the thickening of the basement membranes and microcirculation. This ultimately leads to poor blood flow, called ischemia, and impaired wound healing. A lack of insulin in diabetic wounds also results in increased protein breakdown and decreased collagen formation, which negatively impacts the body's ability to heal the wound. So this dietitian believes good nutrition is key. Good nutrition is essential for wound healing to take place. Glucose provides the body with its power source for wound healing and its energy for angiogenesis and deposition of new tissue or formation of new tissue. Essentially, we must eat well to heal well. We should get adequate calories to remain weight stable during the process. Our calories provide energy to keep the body functioning. Protein is used to build, maintain, and repair body tissues. It is also very important to have a balanced diet to prevent any vitamin or mineral deficiencies. Vitamin C, zinc, and vitamin A, which all can be obtained from a healthy diet, are key nutrients in skin healing. Please discuss these with your healthcare team before considering a supplement. So what should I eat? Grains. Ultimately, we should choose whole grains as much as possible. Examples of whole grains include oats, brown rice or wild rice, quinoa, 100% whole grain or whole wheat bread. A serving is considered a half cup cooked, like a half cup of oatmeal, or 1 slice. And most people need approximately 5 servings per day to promote wound healing. Vegetables, ultimately, the more colorful they are, the more nutrient rich. We should have at least 2 servings of vegetables per day. A serving is a cup of raw vegetables or a half cup cooked vegetables. If they're not your favorite food group, hide them in soups or smoothies. Fruit. These can be used as a topping on your oatmeal or cereal, and having these as a snack or dessert is also a really great thing to do. 3 servings are recommended per day for wound healing. A serving is about the size of a tennis ball. A very vital nutrient to wound healing is protein. We want to start our meal by eating our protein first, just in case we become too full. We want to make sure we get the protein above all else. We should have between 6 and 8 cooked ounces of protein a day when we're trying to heal a wound. An ounce equals 1 egg or a tablespoon of peanut butter, a 4th cup of cooked beans, or even 4 cubes of cheese. An ounce is also about the size of 2 thumbs, and it's a portion of meat, fish, or chicken. Dairy is also an excellent source of protein. Substituting milk for water in recipes is a great thing to do. You might even snack on Greek yogurt, which is higher in protein content than most other yogurts, mixed with fruit. You can certainly add protein to your milk by adding a tablespoon of dry milk powder to each cup of milk. If you're lactose intolerant, some options might be soy or almond milk. Top soups and vegetables with cheese. Try to have at least 3 servings of dairy each day. I mentioned earlier, it is vital that we have enough calories for healing. So check your weight twice a week. If your weight is stable, you're eating enough calories. If your weight is decreasing, you need to add more calories. To increase your calories, add snacks or high-calorie condiments to your food. This is a time when it would be okay to add a little butter or cream cheese, olive oil, nut butters, nuts or hummus to your meal if you're trying to get a little more caloric density into your world. Also, you might consider having a diabetes-friendly nutrition supplement. There's a number of those on the market. Take a multivitamin with minerals if you're unable to eat the minimum number of servings of the different food groups I discussed earlier. Also, check with your doctor before taking any new vitamin supplement. Make an appointment with a registered dietitian if your appetite remains poor, or your wound is not healing well, or you are losing weight. So today I wanted to include 2 recipes. Both of these are protein-packed. One is a yogurt parfait that has 500 calories and approximately 23 grams of protein. Simple to make. You simply layer a cup of Greek yogurt with a half cup of fresh or mixed berries, a 1/4 cup of granola with nuts, and if you need a sweetener, you could certainly do a small amount of honey. I usually do about a teaspoon, or an equivalent of a sugar substitute, for example, stevia or Splenda. A meal replacement smoothie. Let's say your appetite's not strong and you've typically skipped a meal. This smoothie could be used rather than skipping that meal. And it would have 400 calories and 38 grams of protein. To make this smoothie, you simply use 1 envelope of a vanilla breakfast drink mix. I recommend for diabetics Carnation Instant Breakfast Light Start because it doesn't have as much added sugar. 1 cup of milk, a 1/4 cup of crushed pineapple, and finally a scoop of whey protein powder. You mix these together until you have the desired consistency. If you need to add a little ice to make it a little bit creamier, you certainly may. So it's been a pleasure to be with you today, and I want to share just a couple of things. We have a team of people that can help you not only with your diabetes management, but if you do develop a wound. We have an amazing team of medical personnel at the Wound Healing Center here at Titus Regional Medical Center. I've included their phone number, which is 903-434-4800. Please do not hesitate if you have a question or concern about a wound to seek their assistance for treatment of that wound. If you have diabetes-related questions, I continue to be happy to answer questions by phone, by email. I'm located at the Family Care Center on Harts Bluff. I'm really proud of our diabetes care management program because it is recognized by the American Diabetes Association, ultimately demonstrating that it is a very successful program for diabetes management. So if you have questions for me, my number is 903-577-6099. So I would just point out a couple of key points, and that is I encourage my clients to consider themselves the most important part of their diabetes care team. Their care team can be made up of people like their primary care provider, a podiatrist that they see annually, the wound healing team, myself, a certified diabetes care and education specialist, and also a dietitian. But their care team might also have a neurologist, a cardiologist, a gastroenterologist. It might have several other specialties on it. Ultimately, the most important person on that team is the person living with diabetes. They guide all the others, and they certainly decide whether they're going to go to the other appointments. It is vital to have support when you're dealing with the complexities of a condition like diabetes, a condition that's with you 24 hours a day, 7 days a week. So I encourage you to select very good people on your team of support. So I'm going to lay this out with a few questions. If anybody has any questions, I'm more than happy to answer those. If you want to type them on the comment line on the Facebook Live, we'll give you a response within 24 hours. I will say this, if you're more comfortable talking to somebody, please don't hesitate to reach out to me. Call me directly at my number, which is 903-577-6099. I welcome your questions and concerns. If you rather reach out by email, my email address is my name, Christina .graham@titusregional.com. I would be happy to field questions either of those ways. I really do appreciate you coming and joining me today. I see several signed on watching, and I've been happy to meet with you today. I will say stay tuned because I'm expecting a virtual Facebook Live Diabetes Support Group meeting coming next on Tuesday, October 19th at 4 p.m. Have a great afternoon.